Thank you very much for those really rich and I think broad perspective remarks that help us frame the day. So be thinking about, actually be acting upon your questions, and please come up to the mic for the next segment. I'll just kick it off with a question, really perhaps to Denise, but to the whole group. We've been thinking about FERPA. The HIPAA was mentioned, coming in the other direction. You mentioned 42 CFR, which of course is the analogous, are the analogous confidentiality regulations at the federal level regarding substance use. All three are these large and complex sets of regulations around information exchange and restricting it essentially in the name of privacy. And they're while put into place for good reason, their dark sides are becoming increasingly evident. Do you see a movement to tackle that in any kind of synthetic fashion, or are we going to be really, for the foreseeable future, working around them with consents, with exceptions, and so forth?
Okay, I'm not sure if this is on. I haven't seen so much work on HIPAA. It's actually the least restrictive in data sharing of the three laws you mentioned. There is work on 42 CFR Part 2. It's actually had regulations after like 25 years of no new changes in regulations. It's had additional regulations adopted in 2017 and 2018. A lot of it about making information being able to flow through a health information exchange. Also, there is a bill in Congress that would amend 42 CFR Part 2 to adopt the HIPAA provisions for healthcare providers and releasing information for payment, treatment, and healthcare operations, but it does not include HIPAA's absolute wonderful provisions about releasing identifiable information without consent for public health purposes. So there's those things happening. I know there's been a lot of advocacy for changes in FERPA, especially from the immunization community, and they go to the Department of Education and advocate about the regulations, whereas some of the problems are because of the statute. And the Department of Education can't change the statute. Only Congress can do that.
Sure, of course, yeah.
So do you feel like how much of the problem is the attitude of lawyers that say no or who don't get the shared vision, and how much of the problem is the statute and the regulations themselves?
I couldn't give percentages, but I would.
What's your sense of it?
My sense is it's more lawyers than the laws.
I mean, that's my sense.
And the reason is it just really takes a lot of work. I start out by mapping the laws and the streams of data, and then I methodically work through it, and half the time I feel like I'm banging my head against the wall. But I'm really committed to see what way we can share data. Of course, consent is always the gold standard, and with FERPA, if you can pull it off as a practical matter, it's a very simple consent form, but you still have a lot of problems. I've been told, and the Megan, I believe it was, who spoke about the Vision program, I've been told that it's really difficult to get parents to consent for schools to do follow-up to make sure their kids get glasses. And that's where I've gotten questions about, oh, well, can schools do this as an opt-out? If you don't tell us we can't do it, can we go ahead and do it? And unless things are structured in a certain way, and I'd have to think about how you could structure that, generally, no. And I'm always interested in best practices and the results of consent, not just getting a consent, but the characteristics of those who do not consent and who are you leaving out.
Thank you.
Hi, Philip Alberti, AAMC Roundtable member. Thank you all for this great panel and this great day. I could ask this question to anybody, but I think I'm going to ask it to Rochelle. Might make the most sense. So I'd like to spend just a moment, an intentional minute on equity. So we've heard a lot of talk about equity and how much of the interventions that we've heard could potentially have benefits for health and educational equity. We actually haven't heard anyone talk about measuring the inequity or targeting the inequity, to kind of piggyback on what Kent was saying, the action step of what you would do. So you mentioned chronic absenteeism, and it's a composite of approved days, missed days, suspension days. So that got me thinking, well, we know that there are huge inequities in suspension because of, you call it bias, I'll call it racism. And so stratifying some of these educational metrics by race, ethnicity, by sexual orientation, whatever the data we have, provided that it's not a small sample size so the lawyers will get mad with identifiability. But we haven't actually heard anyone kind of being intentional of focusing on the inequities in the system through their measurement, through their programs. I think Ohio had one metric that mentioned they were measuring a disparity. So how are we ensuring that through these interventions we are actually addressing and focusing on disparities? Because if there's one thing I've learned in 20 years of kind of playing that game, if we don't measure it and hold folks accountable for it, it is never going to happen. And in fact, the best intervention that has an effect for an entire school or school system might actually exacerbate inequities if it works differentially well for the majority. So what do we do with measurement and health and education equity?
Well, I mean, I think that question could be answered at many different levels. So to kind of take the biggest level, I mean, I think there are a lot of people that think that national education policy does not really achieve equity. And if you have that first accountability system between the federal government and the state government, and there's a stated, there's a pretty strong fact pattern that equity isn't important, I think there's a reason to think that that could underpin that entire structure, and in fact, you won't achieve equity. But we know there are 50 states out there, and we know that in some states there's a higher value on trying to address that question. And so even with that first structure kind of not in place, there's still the opportunity for there to try to be equity between the state and the school district. I mean, I think it's a very complicated question, and we looked at ESSA and we were like, oh my God, this is really exciting. There's this whole new opportunity. And as we started talking to advocates of many different kinds, I think the thing that shocked me the most was that I feel like I heard over and over again that there's really a lack of belief that the structure of that system might not work, that states don't really have the capability of supporting school districts, which I think kind of was back to Kent's point that, like, if people don't know how to do it, it won't happen. I also think that a lot of the inequity, and there's a lot of fear that labeling schools as failing just reinforces a very negative narrative. So I think it's very, very complicated. I mean, even just to then zoom in on, this issue of chronic absenteeism. And, currently, and again, these are broad generalizations about 100,000 school districts, right? But, attendance has generally been, the strategy has been to blame parents and criminalize kids. And the hope is that through changing the metric to chronic absenteeism and building in an early warning system, that we can change that narrative to be one about supporting families and helping kids. But changing the metric alone will not change that narrative. It takes a whole lot of other community engagement, accountability, discussion, emphasis. So I guess where I sit, not any one of those changes in and of themselves will automatically lead to equity. It has to be about the mindset and the commitment of people in leadership at both a state level and a school district level. And if you're talking about, in so many, I've been working with the Southern Education Foundation on a racial equity leadership project, you're looking at communities where most of the population is white and not African American, but most of the school district is African American because the white families are choosing private schools, but the power structure in the community is not African American, there's no reason that that community wants to invest in the education of those people. And so, you know, I think those challenges of racism are so much deeper than any one of these policy solutions. I wish I could find the silver bullet that, you know, Kent didn't find in the last 15 years, but hopefully that helped answer your question.
Thank you.
Matt Stiefel from Kaiser Permanente. Another measurement question. I appreciated Dr. McGuire's broad framing of measurement, but the measurement that we see coming out in both health and education for kids has most to do with development and readiness and showing up and functional status on the way to becoming adults and productive members of the society. And perhaps in retrospect, they shouldn't be in such a hurry to get there. But there's not very much in both fields about quality of life or well-being along the way. And perhaps in focusing more on the along the way and these measures of quality of life and well-being, in fact, in the driver diagram would help the readiness and development and functional status along the way. So I'm just curious your thoughts about the a framing or reframing of measurement to include those outcomes, those human outcomes.
I'll just say, well, I agree with that. And one thing that I'm encouraged about is this budding conversation on the education side, at least, in which a number of health folk are involved about this so-called science of learning. And in that conversation, you know, these measures of health and well-being are being lifted up, and folks are trying to grapple with, okay, well, what are the implications of this emerging knowledge for practice, which gives rise to conversations about what's that mean for what teachers know and are able to do at the level of the classroom? What are the implications of that for how schools organize to do what they do in the first place? What are the enabling policies at the district or state level that would create the kinds of incentives and supports that would kind of let adults do all of that, and where will national policy step in, you know, to sort of stimulate all of that? I think that bridge is barely being built. You'll hear a lot of philanthropic attention to that soon. You will see a consensus report coming out probably in the fall. So things are kind of heating up around that. But your sort of underlying point is very well taken.
Well, and just to quickly underscore at a very different level that point, I am the very proud mother of a 33-year-old daughter who has just completed her 11th year as a middle school special ed teacher on the west side of Chicago. And we got a very unusual, and my daughter has had a miserable year. She has felt like a failure. She's questioning whether this is the right thing to do. And on Tuesday night, we get a phone call from her principal, and I'm like, oh my God, she's on a field trip, something terrible must have happened. But he just wanted to let us know that my daughter's student had record improvements on all of their test scores, and she's in the KIPP network, and out of all of the KIPP network, her improvements were #1 for all of their special ed teacher, and he just wanted us to know. So first of all, having the principal call the parent of a teacher, that was kind of odd. But I was just really struck by trying to balance how that she has had this metric that now she is being celebrated for in her school and her network, and her total sense of kind of feeling of failure. And so I called her while she was at bowling alley with all of her kids, because they go to the University of Illinois, and said, when I get home, we'll talk more about it. But I really do think it's not just me telling how proud I am of my daughter, but, really relevant to this disconnect between metrics and readiness for life. And she basically feels she hasn't helped her kids be ready to succeed in life. So just to share that. I have a wonderful son too, by the way.
This is being webcast. You've got to get it out there.
That's right.
So is that my cue to ask about your son? Jeff Levy from the Roundtable in GW. One 30,000-foot comment and then a comment probably more relevant to the panel. The 30,000-foot comment is, we've heard a lot today about education and health and how they work together in metrics. It is metrics and incentives. And I think for the roundtable, something for us to consider is that that case for this collaboration is the easiest in education and health, and much harder and feels more distant, I think, for both sides when we talk about other social determinants of health. But I think we learned a lot today about what we need to measure and how we can measure, and how we can, in a sense, bundle measures so that each sector feels like they have incentives within their own frame of mind, and that there's really important work for us to do as a roundtable or as a community or whoever, about how we translate social determinants of health into metrics as well as incentives. Different subject, much narrower, but I also think important. We've heard a lot today about HIPAA, FERPA, and privacy and how we need to be sharing data, and I very much want that to happen, but I also think we need to remember why those laws are in place. And the 42 CFR Part 2's discussion is what sort of incentivized me to think about that. We have to be really careful about the changes we are making and understand why they were put in place in the first place. To take it back to education and health, I first learned about confidentiality laws around HIV and names reporting and AIDS reporting, and that was at a time when local elected officials wanted to know from health departments the names of HIV-infected teachers so they could be fired. That seems like ancient history, but it's not. We also need to remember that all the kids who registered under DACA were promised by the federal government that there would be absolute confidentiality and there would be no consequences. You see a change of administrations and you see severe consequences. So having that legal protection is incredibly important. And at a time, and 42 CFR Part 2 is about substance use, admitting to providers about illegal activity. And in the current climate, that may not be something we want to, those protections may not be something we want to diminish, or at least take that diminishment. We need to take that very seriously if we make any moves.
Thank you for that.
Hi, Han Kyo-Yu from the California Endowment. I just want to express appreciation, the comment earlier about equity and your thoughtful response, Rochelle. But I would want to continue to push us to be thinking about this, because probably one of the statements that stayed with me from the first panel was about, it's not about fixing kids. It's about fixing parents and the systems. So just to push us to think about the role of data and success metrics, and how we think about having a shared analysis about the root causes of inequities, and not using that data to pathologize children and their families, but to turn it on and think about the metrics of the blind spots in our systems, and being able to continually go back to the systems to really look at those success metrics, because they matter in terms of how we think about equity or inequities in this work. And so I'm just not hearing enough of that in this conversation and what we can do about it in terms of the evidence base about what works and what doesn't. So thank you.
I want to plus one that and observe about the process I described, how easy it is, even in trying to imagine indicators and then appropriate measures for those indicators, how quickly we often slide back in to putting the onus on kids. It is really easy to do that because most of the existing measures and the narrative and discourse around them does that. You know, we live in a world where the conversation is about deficits. And so we actually struggle consciously with trying to pull things back up to the institution and system level. So your point's very well taken.
This is sort of an end of the day comment. Maybe it's a little bit more directed toward Kelly because this is sort of a big macro policy issue. But you know, we heard the day started out with Steve Wolf making a very persuasive argument that that there's a relationship between educational attainment and health outcome. And the suggestion was maybe if we invest in education, then we'll achieve greater health. And then Chuck Bosch made the argument that, well, we should also consider the reverse, the other direction of causation, that if we invest in health, maybe we'll get better educational outcomes. And so everything was good. You know, we thought, well, we should invest in both those things. But, you know, the difficulty is that one system is much more, I think, more efficient than the other. And so, you know, Kelly made the comment that was intriguing to me, and that was that states that accepted the Medicaid expansion actually had better educational outcomes. And what struck me as interesting about that is, by the way, I'm a big supporter of universal access to healthcare. I'm not arguing against that, but the NBER just came out with this report suggesting that one thing that didn't happen as a function of Medicaid expansion is better health outcomes. In fact, there's nothing, according to this analysis. So investing in Medicaid expansion, and by the way, you know, the kids are mainly in CHIP, right? So it's, I think the suggestion is some, but
4 times as many kids are in Medicaid than in,
okay,
in CHIP.
So Medicaid expansion doesn't improve health outcomes. And the question is, well, should we be investing in Medicaid to achieve better educational outcomes, or is that the wrong way to do it? So, for example, putting money into this overfed healthcare system doesn't seem like an efficient way to achieve health outcomes. And on the other hand, you have an education system which, relative to the healthcare system, is completely starved for resources. And so might that be a very inefficient way to try to achieve higher graduation rates?
So you've given me sort of like a day's worth of stuff to talk about. So I'm going to try to do it in a short amount of time because I know that everyone is at the end of their day and the end of their caffeine bloodstream. I first would take strong issue with the analysis that expanding Medicaid does not improve health outcomes. You can measure it in certain ways around life expectancy that don't show dramatic changes, but across a whole lot of metrics, we see the lowest performance for people who are uninsured and even people who are intermittently uninsured, and Medicaid does a lot to change that. And I also think that there are a lot of other really important ancillary benefits to kids' educational outcomes from their parents being insured and them being insured that have nothing to do with their health, but have to do with preventing some of the traumas that are associated with their parents' mental health issues and addiction problems and being out of work and having high medical debt. And the numbers of outcomes that we've seen in economic security for families that have gotten coverage through the Medicaid expansion include reduction in payday lending, reduction in overall family debt, reduction in bankruptcies, reduction in all sorts of things that I think it's not just about was I healthy enough to go to school, but also really speaks to a lot of the socio-demographic structures that we've talked about today that impact child learning. And so I would say, if I were only trying to achieve the outcome of how do we improve graduation rates, would I say the most efficient way to do that is to expand Medicaid? No, but if you asked me, how do you improve health outcomes for kids and their parents and improve economic stability and improve readiness and improve food security and housing security, then I think it's a really wise investment. And I think it's especially wise in this moment because we have made a federal decision for the federal government to invest 90% of those costs. So for states to now find a marginal amount of resources to have that impact, I think is really good. And then you're right, the healthcare system is bloated. But is the way that we reduce that bloat by not investing in getting the remaining people coverage? No, the way we do that is by saying, hey, bloated managed care companies, why don't you go out and figure out how to improve educational outcomes and other things in partnership with your community in order to earn the full capitation rate that we're paying you today? Or hospital systems. You have found through the hospital leadership at the Children's Hospital of Cincinnati has done an extraordinary job of finding the personal moral wherewithal to invest from their overall budget that is earned through their rates and their billings to then reinvest in the community. Surely other hospitals also have to have that same sort of capacity for these partnerships. How can we bring some of that money into alignment with our broader societal goals rather than saying we have to measure every decision about expanding coverage within every new dollar of healthcare spending on whether or not it's going to solve all the problems. And I think for Medicaid, I'm so happy and so angry at the Medicaid system, right? It's joyous for me that Virginia just expanded. We've got ballot initiatives in Nebraska and Idaho and Utah. People are going to expand there in the ballot box. I'm also so angry at the Medicaid program for not living up to the promise of coverage in so many places. But we've got to keep doing all the things. We can't. It's really makes a huge difference. And I'm happy to send you more research about the health outcome improvement.
Thank you for that answer. We have time for one more focused question, I think. Correct me if we have time for two, there will be second. So, no, one. Okay, it's one. Pamela.
Hi, I'm Pamela Russo from the Robert Wood Johnson Foundation, a member of the Round Table. And it's largely directed toward Rochelle, but Denise might want to weigh in, or it's about ESSA, and you were part of you were a partner with the Health Impact Project, who we fund to do a health impact assessment of ESSA before it was finally passed. So I'm curious if you think that changed anybody's mindset, if you think it changed anything in the actual bill. And then the second follow-up of that is we're now, through the Health Impact Project, supporting Community Catalyst, because ESSA is implemented at each state, right? And so there's room to also address things at the state. So what Community Catalyst is working on is to bring in a piece about assessing student substance abuse and getting them not a punitive reaction or report to the police, but treatment. And they've been successful doing that in Florida, and they're now working in 3 other states. So I'm interested to find what you think about this, whether you think there's other state level interventions that could happen.
Yeah, well, thanks for that question. So we were very involved with Pew on that health impact assessment. It was done, though, actually shortly after the law was passed, and it was done during the kind of initial phase of the regulatory process. And I think if there had not been a change of administration, it would have had a little bit more impact. But the resulting document was just so well done, and actually it offers one of the best and most recent compilations of the impact of health interventions on education. It's just an amazing source. But it also created a framework for a conversation that many organizations, including us, have followed up with, which is now working with states across the country, and we were not able to work with all of them, but a small handful of states across the country, so that trying to get some of those recommendations. So they made that HIA made the broad argument. We then took that and said, what are the actual metrics that you could actually put in a needs assessment? So our document built on that, and now we're working in a number of states to try to get that to be used. You know, implementation, in general, one of the challenges of implementation is that, you know, the regulatory process kind of got thrown a little bit up for grabs. If I'm remembering correctly, Congress revoked 2 sets of regulations that the Obama administration issued, and one of them was all of the ESSA regulations, and then 3 days later they issued guidance. There was a lot of confusion with states about, I mean, the whole thing really made it really challenging for states to implement, and then states are on very, very different schedules. So kind of the good news is there's still a lot of opportunity for engaging. The Trump administration's requirements around the state plans were so vague that states didn't have to decide that much, but now that decision-making is happening at every state level. So there's lots of opportunity for engagement. Robert Wood Johnson is actually funding us to work in a number of states to promote that needs assessment. We're also starting to look at those evidence-based practices. So I think there's a lot of potential, but every state is complicated, and it's not an easy, it's not like an easy fix. But, you know, we heard for 15 years that No Child Left Behind, and the way it was structured was the barrier, and we have to try to take advantage of the opportunity.
So before turning the floor to Sandy Magnan for reflections and closing remarks, just a strong round of thanks to our panelists. Really terrific. Thank you so much.